Hello viewers, today I thought we should discuss Rinne's test and Weber's test together. I have made separate videos about Rinne's test and Weber's test, but often during MBBS ENT assessment, Rinne's test findings and Weber's test findings are given together, and they might prove to be quite challenging even for experienced ENT surgeons. Speaking of experienced ENT surgeon, I am joined by Dr. Pritha Ghosh, who will soon be taking MRCS ENT OSCE, and we will discuss how difficult interpreting Rinne's test and Weber's test is even for seasoned ENT specialists. So, Dr. Pritha Ghosh, are you ready?
Yes.
So, I will give you 4 or 5, I forget the number, clinical scenarios, and you have to give me the most likely interpretation. Of course, the interpretation has to be most likely because Rinne's test and Weber's test alone are not enough to definitively diagnose a particular type of hearing loss. But what is the most likely explanation of the findings obtained on performing Rinne's test and Weber's test in different patients is the pattern of the question, and I'll be expecting the most likely interpretation from you. So with that out of the way, let's go to the first clinical scenario. And the first clinical scenario is this. On your screen, you can see Rinne is positive bilaterally and Weber is not lateralized. Again, the technical terms for the interpretation are used here. What does Rinne positive mean? What does Weber not lateralized mean? That is something you should be knowing as ENT specialists. So this is just the information that you have. How do you interpret this? Dr. Pritha, what is the most likely interpretation?
This is most likely the hearing in both his ears are normal.
Okay, so that is the correct answer because Rinne positive might mean either sensorineural hearing loss or normal hearing. And Weber not lateralized indicates that perhaps the hearing is normal bilaterally. That is why Weber is not going to either side. However, there is a pathology in which case the same findings can be obtained. Dr. Pritha, can you tell me what unlikely possibility that is?
Patient might be malingering.
That is also a possibility because these are subjective tests and patients often don't understand the instructions or deliberately mislead the doctor. But I am asking about a pathology which is definitely there and can produce the same results. Can you think of that, Dr. Pritha?
No.
Okay, so as I said, Rinne positive can mean either normal or sensorineural hearing loss. Now, imagine a patient who has equal sensorineural hearing loss bilaterally. In that situation also, Weber will not get lateralized, but that does not mean that the patient has normal hearing bilaterally. In fact, the patient can have bilateral dead ears. And if you tell the patient based on these results that his hearing or her hearing is normal when they in fact are deaf, then the patient is likely to get quite upset. Do you agree with me, Dr. Pritha?
Well, I beg to differ here. I'm sorry. But if the patient is absolutely deaf, I do not think he will have a positive Rinne in both the ears because his air cut, I don't think.
That is absolutely correct. But what if the patient is not absolutely deaf, but slightly deaf?
In that case, if they have a equal sensorineural hearing loss, which is not profound, maybe, then this could be a scenario as well.
So patient with symmetrical sensorineural hearing loss might also present with the same findings. But that is a very unlikely scenario. The most commonly accepted answer in this situation is normal hearing bilaterally. Moving on. Rinne positive bilaterally, Weber lateralized to right ear. Most likely interpretation.
Rinne positive bilaterally. And Rinne, that means the patient has a left-sided sensorineural hearing loss, most likely. That's why Weber is lateralized to the better ear.
Okay, so whenever you see the Weber is getting lateralized to one side, you have to suspect a pathology. In this case, Rinne is positive bilaterally, so the pathology is most likely sensorineural hearing loss. And in sensorineural hearing loss, Weber gets lateralized to the better ear. So in this scenario, as Dr. Pritha Ghosh has described, there is unilateral left-sided sensorineural hearing loss, which automatically makes the right ear better. Can there be any other explanation for this situation?
It could be that there's a sensory neural hearing loss in both the ears, but the left ear has a worse hearing.
Very good. So bilateral sensorineural hearing loss with right ear being better. As it's important point to remember here is Weber gets lateralized to better ear in cases of sensorineural hearing loss. It does not automatically mean that the other ear is normal. The right ear can also have sensorineural hearing loss, and that will also be a positive Rinne. But if the left ear sensorineural hearing loss is worse, then Weber will be lateralized to the better ear, which in this case can be the right ear. So there are two possible explanations: unilateral left-sided sensorineural hearing loss or bilateral sensorineural hearing loss where right ear is better than left. Very good, Dr. Pritha. Moving on to the next station. Now in this station, Rinne is negative bilaterally and Weber is lateralized to right ear. What is the most likely explanation?
So it means that the left ear has a false negative, which means the left ear is profoundly deaf. A sensory neural hearing loss in the left ear.
I don't understand, Dr. Pritha. Rinne is negative bilaterally. Do you want to change
Yes,
your answer? Rinne negative
Rennie is
bilaterally?
and then Rennie. Yes, that could be that there is right-sided conductive hearing loss.
Okay. Yes, so that is a definitely
Or
acceptable answer because Rinne negative automatically raises the suspicion of conductive hearing loss. Rinne is negative bilaterally, which means most likely bilateral conductive hearing loss. And Weber in conductive hearing loss gets lateralized to the worse ear. So in this case, maybe it is bilateral conductive hearing loss with right ear being worse than left. Do you agree with me, Dr. Pritha?
yes,
Does this
please,
make
sir.
sense? Looks like Dr. Pritha Ghosh is not agreeing with me. So let us explain the mechanism of this. Rinne negative means bone conduction better than air conduction. Air conduction
Right.
is severely reduced or significantly hampered in conductive pathologies. That is why bone conduction, that is when the tuning fork, vibrating tuning fork is placed on the mastoid, the sound is heard louder or for longer duration than the sound when it is presented in front of the external auditory canal. So bone conduction is more than air conduction. This is seen in cases of conductive hearing loss. Why does Weber get lateralized to the worse ear in conductive hearing loss? I have made a video about this. Weber test usually tests only the bone conduction. You place it on the midline, somewhere on the glabella, and then you perceive the bone conduction bilaterally. Now, if there is conductive hearing loss, this creates an occlusion effect, which can be mimicked if you occlude your tragus. If you push your tragus backwards and occlude the external auditory meatus, that also mimics a conductive hearing pathology. Basically, we try to close our ears to not hear the sound. That is, we are trying to mimic the conductive hearing pathology. What happens when you occlude the external auditory meatus is relative increase in bone conduction automatically happens. Now, in conductive pathology, this occlusion effect is created by the disease. So the bone conduction on the more affected side will be relatively better compared to the less affected side. That is why bone conduction is perceived louder or perceived more on the worse ear in conductive hearing loss. So this is really negative bilaterally, and Weber is getting perceived on the worst side, that is the right ear. So most likely explanation in my book is bilateral conductive hearing loss with right ear worse than left. Here we will not go for unilateral right ear conductive hearing loss because Rinne is negative bilaterally. This is probably the most likely explanation. If you differ with my explanation, please feel free to reach out in the comment section below. Do you agree with me, Dr. Pritha? Is this making sense? Okay, so moving on. Now we have Rinne negative in right ear and Rinne positive in left ear. Weber is lateralized to right ear. So Weber is getting
So
lateralized to
this
the ear,
is
which is negative.
so
Yes.
this is mostly conductive hearing loss on the right side.
Yes. So this makes sense. Rinne negative automatically raises the suspicion of conductive pathology. And then we go and check the Weber and we see, yes, Weber is also going to the same ear, that is the right ear. So right ear, conductive hearing loss, Weber going to the worse ear, which is the right side. So most likely this is right ear conductive hearing loss. Very rightly said by Dr. Pritha Ghosh. The final situation for today is Rinne negative in right ear, Rinne positive left ear, Weber lateralized to left ear. So not lateralized to the side which has negative Rinne. What do you think is the
This is
explanation for this?
profound sensory neural hearing loss in the right because the ear is dead. So there's a transcranial transmission to the better ear.
Yes, so what is this Rinne negative called in the right ear?
This is known as false negative Rinne's.
Yes, this is false negative Rinne. As you know, Rinne becomes negative when bone conduction is more than air conduction. That is the sound perceived when the vibrating tuning fork on the mastoid is louder than the sound perceived when the vibrating tuning fork is placed near the external auditory canal. In this case, when we place the vibrating tuning fork footplate on the right mastoid, the right cochlea does not hear the sound. The left cochlea is hearing the sound because the right ear is completely dead, which is profound sensory neural hearing loss. The left cochlea is hearing the sound by transcranial transmission of sound. So also the clue here is the Weber is getting lateralized to the opposite side, not the same side. So this is a condition where there is false negative Rinne on the right side, which is seen in severe or profound sensory neural hearing loss of the right ear. Very rightly said. This is perhaps the most difficult clinical scenario involving Rinne's test and Weber's test, and Dr. Pritha Ghosh has answered it very correctly without any trouble. So I hope this video will help you understand the nitty-gritties of how to interpret Rinne's test and Weber's test when only these two findings are there. In the real world, we have the benefit of history taking, clinical examination, and other tuning fork tests as well. So maybe in the real world, we don't have to diagnose just on the basis of limited information. And as illustrated in this video, just the findings of these two tests sometimes creates a bit of confusion, even among seasoned ENT specialists like Dr. Pritha Ghosh and myself. So I hope you like this video, and if you have any confusions, please feel free to reach out in the comment section below. Dr. Pritha Ghosh, do you have any words for my viewers?
No.
Thank you, Dr. Pritha Ghosh, for your time, and I'll see you in the next one.
Yes. All right.